Hi PCIS health students. I hope you guys are all doing well today. I loved your photo projects that you sent me. I felt like really so inspired by seeing the way that you interpreted that project. Some of you told me that you had a lot of fun with it, which makes me really happy. And I hope to be able to continue to give you guys some assignments that are both academic, but also maybe something a little bit interesting or fun or funny that you can enjoy. So since we're currently in our infection prevention unit, it's quite a timely topic right now, and I thought I would just go ahead and continue to teach you guys about infection prevention and to use our current situation as an example and to help you guys understand more about what's going on and learn about the ways to fight this pandemic. So I found a really cool article that has some neat simulations that I wanted to show you guys. Here, let's just take a look at it. They are talking about the United States, and they're showing the exponential growth right there. Can you see it? That is the growth that they've been seeing. And it's talking here about the exponential curve. So they said that the reason we're worried is that if cases continue to double every 3 days, that would end up with 100 million cases in the United States. That's crazy, and that's what we don't want to happen, right? Okay, so this is really interesting here. This is a simulation. Actually, they've called this illness, it's kind of a fake illness that they made up for this, called simulitis, as in simulation. But you guys see the dots moving around on the screen? That is a model of what is happening whenever the population is able to just move around and act, do their normal daily activities and not do anything to try to stop the spread of the illness. You can see the blue dots, the orange dots, and then the pink dots. So the blue dots represent the healthy population. And then they just start in the very beginning of it. It's like repeating a few times, so you guys can just watch it and see as it starts at the beginning again. Like right now, they're all pink. That's showing the end of the progression of this. But here, they're almost all blue, right? At the beginning, they have one orange dot. And as that one bumps into another one, it's representing contact between people. And you'll see that pretty quickly it spreads around to everyone, right? Because everybody is intermingling. And then eventually they start to turn pink, and in this simulation that represents people who have recovered. So you guys can observe what's happening at the top with that curve too. Over time, you have a big peak, and it comes back down after people are recovering. So the thing is, though, that we don't want to have such a massive peak, right? And so how do we prevent this type of spread in the population? We're going to look at another simulation in just a second of what would happen when we have part of the population staying home and not out contacting each other. So what you guys are looking at now on your screen is a simulation of what happens when 1/4 of the population is still moving around, just kind of going about their day, while the rest of us are practicing social distancing, staying in our homes, and just kind of waiting this out and trying to reduce the spread. I want you guys, it's going to start again now. I want you to watch the curve at the top. You can see that it's a much slower initial growth. You guys can see the orange part there on the graph. And the amount of sick people is increasing, but it's very slow and what we want to say like flatter curve as the people who are recovering are also increasing. So here, this study mentions how governments and local communities find ways to help reduce people's interest in going out. It's saying that they end up needing to close down restaurants, close the stores, and basically stop, close public spaces to discourage people from gathering. And that's what we see here right now. Whether we like it or not, that's what we're having to do to just encourage everyone to do the right thing. So with that in mind, we have our final simulation here. This is if only 1/8 of the population is moving around. You guys can watch the blue dots that are mostly staying in place, staying in their homes. The pink dots are people who've recovered, who were ill. The orange dot, as usual, is the person who is infected. And you can see how many turn orange as it spreads. Another thing to look at here is the recovery rate. It starts to really increase, you start to see more and more pink dots, so much so that you no longer have sick dots moving around. You have some that are staying in place, the people in their homes, which is what we want people to do when they get sick, is kind of self-quarantine. But we see a major reduction in how many orange dots are moving around and able to infect anyone else in the community. So much so that ultimately it just stops. You don't see any more sick people because everyone's either recovered or healthy. I want you guys to also look at the curve at the top. Just check out how flat it is, and also the small amount of people that actually got sick in the long run. So this is, our goal, and it may take longer. It may be super inconvenient right now and kind of weird, but everybody who studies this really believes that this is how we keep more people healthy and safe, keep our medical system able to take care of everyone, whether it's because they got a virus or whether they needed some other kind of care. We don't want our hospitals overrun for a lot of reasons right now, and I think everybody can agree with that. What I would like to do now is go over some vocabulary for the last few minutes of this video. Hopefully you guys all remember that we were studying toxicology most recently when we were in class, and another term I want to go over is epidemiology. Epidemiology is the study of diseases in a population. You can see why this is an important term for us right now. The word comes from the Greek for the study of what is upon the people. The goal of epidemiology is to make choices to protect the public and to study how we can best prevent and treat illnesses in a population. So there are 3 categories of illnesses that I want to tell you guys about today. The first one is an endemic. This is a disease or a condition that we regularly see in a population. For example, chickenpox, or a type of flu that you would see every year that's just always taking place in a certain area. For some countries, malaria is endemic. You might have heard the word endemic before when talking about certain types of plants or animals that are local to a region. But now we're specifically using the word more as a noun to describe a type of illness. So your next term looks a little bit similar to this word, but look carefully at the spelling. It's actually an epidemic. So an epidemic is an outbreak of a disease that infects many people at once, and it starts spreading all around a community very quickly. You may hear it referred to as an outbreak, and we call it an epidemic whenever it's going around one country or several communities in a country, or even a few different countries. But if we start to see a disease spreading through almost all the countries in the world, or every country in the world, then they call it a different word, which is pandemic. A pandemic is when an epidemic spreads throughout the world, which unfortunately is what we see now with coronavirus. So you guys may remember last week when the WHO, or the World Health Organization, declared COVID-19 to be a pandemic. It's the first time we've ever seen a coronavirus actually cause a pandemic. You may not realize it, but there are lots of coronaviruses. There's several different strains of it that affect humans all the time that are not deadly, or like no one even really notices, right? But then there are also a couple coronaviruses that we've seen in past years. You might have heard of SARS, severe acute respiratory syndrome, or another one that happened in the Middle East, so it's called Middle East respiratory syndrome. Those, unfortunately, had a much higher death rate. They were much more deadly than this one. And scientists have pointed out that that's actually why the current one is spreading so rapidly, which is partially a good thing that most people can survive it and maybe don't even know they have it, which is also the bad thing, because it causes it to be spread so rapidly that, like we're seeing right now. When the other ones were very, very dangerous and deadly, and people died almost always when they got them. And so they weren't able to spread. So when I read the statement from the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, I really liked the words he used at the end of his statement after explaining why we are declaring this a pandemic. He said that, there's been so much attention on this word, and he doesn't want people to be afraid because we have to use this word now. And he said, let me give you some other words that matter much more and that are much more actionable, meaning that we can kind of go forward together and act with these words in mind and remember that this is only a temporary thing that we're dealing with right now. So what he said was, instead of focusing on pandemic, let's focus on prevention, preparedness. That means being prepared, being ready to be safe in these situations. Public health, taking care of all the people's health. Political leadership, listening to the people that are telling us how we can stay safe at this time. And most of all, people. He said, we're in this together to do the right things with calm and protect the citizens of the world. It's doable. We can do this, guys.